Health Spotlight, presented by Community Health Network.
We're welcoming in Wish TV medical expert, former U.S. Surgeon General, Dr. Jerome Adams. Thanks so much for coming in. I know it's been a busy day.
Busy day, but I've been downtown. The National Conference of State Legislators is downtown, and Dr. Rahul Gupta, who is the Office of National Drug Control Policy Director, was in town, so I had a chance to have a conversation with him.
Good conversation with him. I know he also met with Governor Holcomb. So what are your takeaways from the time you had?
Well, he talked a lot about how the opioid epidemic has evolved from heroin to fentanyl to now a lot of it is being transmitted via pills and online. And he also emphasized a new study that came out showing the impact of the opioid epidemic last year was over $1.5 trillion. Meaning the opioid epidemic is costing us more than the GDP of most countries.
We had a bullet point wanting to talk to you about that very thing. The CDC released the report saying 110,000 people died last year of drug overdoses in the U.S. The DEA found 6 of 10 opioids purchased online contain some amount of fentanyl. So what can be done to lower those numbers in your mind?
Well, I want to hit on something that Dr. Gupta highlighted, and it shocked me as a parent of 3 different teenagers. A lot of young people, they've become acclimated to this culture of pills and going online to get different pills that they don't always know are opioids. But 6 out of 10 of those pills that are purchased online have been shown to have fentanyl in them. That means you may think you're getting Ativan, you may think you're getting Valium, you may think you're getting something else. 6 out of 10 have fentanyl in them. They can be deadly in an instant.
That's terrifying. Just even coming in skin contact with a pill with fentanyl in it, right?
So one of the things that the administration is highlighting is the availability of naloxone. So they also said that about 60% of opioid overdoses are witnessed, but naloxone is not administered. So we want to make that available on college campuses. We want people to be aware of it. And we also just want young people to be aware of how dangerous, how one bad decision can take your life in an instant. Buying pills online or getting pills from someone who you don't know and that hasn't been prescribed for you can be.
Sure, and it's scary that this is a trend that needs to be addressed instantly. Another stat that's startling, suicide deaths in the U.S. hit a record high last year with 49,000. But a new report shows that half of those involved firearms. Is there a solution that you see that can turn this tide?
Well, a lot of solutions exist out there. I'm a gun owner myself, but I believe in responsible gun ownership. So helping people understand the importance of locking up your guns so that young people can't get to them, so that people who are in a mental health crisis can't get to them. And I also want to highlight, and we talked about this last week, Drew, 988. 988 is a new hotline available for people to call if they are in a mental health crisis, but less than 1 in 5 people are aware that it exists. So we want people to be able to get the help when they need it at that critical point and not to have an access to a firearm, a lethal means, if they are in distress.
And I know part of the motivation in creating that was to simplify it because so many of us know 911 and this is an emergency as well, but it's 988 specifically for that.
Exactly.
To reach out for that national level
crises, and they will connect you with mental health providers. Far too often we rely on our law enforcement officers to be mental health providers. That unfortunately can escalate the situation and turn a situation deadly. But being connected with a mental health provider through 988 could actually save a life.
Finally tonight, because I know we're running out of time, unfortunately, but new research shows that 80% of Americans are not up to date on COVID-19 vaccines, and the number's higher in Black and brown communities. So what do you want to see happen to get more people vaccinated?
Well, we just heard from the CDC director that the updated vaccine, which is going to be updated to respond to the currently circulating variant, will be available sometime in September. We want everyone to know that getting this will lower your chance of being hospitalized and of dying, and will give you greater freedom to be able to interact in society without that fear of ending up in the ICU. So please get your flu shot this year around Halloween time, and when it comes out, if you're eligible, please get your updated COVID vaccine. It really can be the difference between life and death.
Okay. You have heard it from Dr. Jerome Adams. Thank you so much.
Appreciate you,
as always.